Well, good morning, everybody. Mark Rogers here. Hope you are well. Good morning. It is harvest time. Harvest time. Yes, indeed. It's harvest time. You saw that picture there in the, that's, that's the harvest grapes I'm looking out over, and we're going to be pulling some juice off that here in a little bit. The harvester went through already on that, so it is good to be here. It's best time of the morning, best time of the year, that is. And anyway, I just wanted to say hi to everybody as we go live. You know, we got a kind of a little schedule here. I'm going to keep it quick, keep it short. As you know, it's Medicare window right now. Started October 15th is really when you can start making decisions, but I'm trying to share information specifically for you and get you all caught up as to what is going on. I have the agenda, quick agenda here. I like to go over why it's important to do healthcare learning. I also have a quick timeline process here, real simple, and then how to start, plan, enroll. This is something that the new system coming along that I wanted to get out and get going and share details on as well. So I wanted to update us on that. And then we got some product events coming as well. I'll share a little bit about that as well. So with that, let's jump right over into why I even do these streams. And as I work with retirees want to have security, retirees want freedom, retirees want control. But there are factors associated with that make it very, very difficult to attain the security, the freedom, and control. Let me give you an example here. So Fidelity does a retiree health cost questionnaire every single year, and they update this data. As of last year, 2022, the retiree says that at age 65 for a couple, average retired couple, that they may need approximately $315,000 saved after taxes. Now, I want to stop there for a moment. People think that, oh, I've got a 401k, $800,000, $1 million. You know, I'm all good. I'm all good. No, it's after tax dollars. That's an important piece of it. People do not understand what a 401k, IRA, 403b does in terms of paying for healthcare expenses. And so that is important to see that Fidelity is saying the research should be around $315,000 average. Some are going to be lower, some are going to be higher. The problem is, what the problem registers in people's minds is the fact is that I may run out of money, right? I may run out of money. That's a true story. And so I wanted to at least share that data point every time and say that is what we have up on deck. Now, for today's news, I actually have something here that is exactly what we're talking about here. This is out of the math on retirement healthcare costs is scarier than it looks. This is put out by Think Advisor just here a couple days ago, September 27th it was. It says millions of older Americans and retirees are grappling with the challenge of creating a secure income stream that may need to last 30 years or longer. And one area that must be at the forefront of financial planning discussions is the potentially devastating impact of excessive healthcare costs. And so this founder and CEO of HealthView Services, Ron Mastrogiovanni, I hope I got that right. He's basically saying that alongside the decline in defined pension plans, now that's important to note, is we don't have the pension plans that they had back in their 70s and 80s. That is becoming less of a reality. He says the declining pension plans, corporate America has shifted rapidly away from providing supplemental retiree healthcare support, even for long tenured workers. This means Americans are increasingly left to rely on their own Social Security, private savings, and Medicare to address the often mountainous cost of care. The potential costs of long-term care, prescription drugs, and hospital stays can derail the financial plans even retirees with millions in the bank. Think about that. Millions in the bank, especially in the case of chronic physical or cognitive illness. This is sobering. People do not understand. Now, the state of the various states right now, as we're speaking, are looking at this going, how do we circumvent this problem where the folks fall on the states? The federal government knows this as well, that the healthcare costs associated with in retirement are extraordinary and may drain a lot of retirees' savings accounts. So, that is, and this is really, really good to see, is basically, as the analysis explains, the first baby boomers started to retire in the late 2000s, have been entering retirement at a rate of about 10,000 a day, driven by this demographic wave. Why the number of Medicare recipients have increased by 39%, jumping from 47. This is phenomenal to see this, right? So this is where I'm trying to help as many retirees as possible understand this, and then furthermore, how to build specifically planning associated with it, okay? So that's what I'm trying to do, is alert that the government knows this. Shouldn't you know this as well, right? Shouldn't you know this as well? So now, switching gears here, you probably got in your mail here the Medicare and You book, right? The Medicare and You book is sitting here, and I understand it came in the mail to you. You know what? You don't have to read everything here. I would like to share a few things out of it from time to time. I thought if you flipped on down to page, let's see here, it's going to be this, let's see here, right, trying to get it to right here. So it's important to see that Medicare, we're going to go over Medicare A and B and a little bit closer here, but I want to make sure that you understand that you're in this period of time right now in your annual enrollment period. Here it is right here, that this October 1st this is where you're able to get actual planning details. And then we run this period from October 15th through December 7th, okay? So this is very important. This is why I'm bringing these live streams out. Share with your friends, right? Share with your friends, because I'm going to be exposing more stuff as we go along the way, not only from the news, but I'm going to dive into, and I'm going to do this here in just shortly, I'm going to dive into specific ways to build that security and control. I'm going to be bringing more stuff along the way, okay? Just going to take a brief intermission here, quick broadcast break. The information offered in this live stream is meant to be fun and educational. You're encouraged to consult a licensed insurance agent regarding your specific needs and situation. Of course, join us live on the Tuesdays, Wednesdays, and Thursdays in October here. Of course, share with your friends, and we are only live.